The current state of COVID-19 is we're seeing the rising of the curve. And you guys see this on briefings from the governor. If you watch, a lot of people live on the river, so they'll see the Ohio governor speaking or the governor of West Virginia and their public health officials. And by the way, both states are working very actively together in their public health efforts. So in a sense, the information you see reflects more of a regional approach to this. We are on the escalating part of the curve, and anybody can see that. You're watching numbers of cases increase, you're watching numbers of people hospitalized increase, and this is what we're really concerned about. The curve will get steeper vertically if we don't social distance, if we don't engage in rigorous hygiene, if we're not exceptionally careful about who we come into contact with. And this explains why the order to stay at home has occurred in both Ohio and West Virginia. And again, I'm speaking to the river communities because this message will go out to both. If we do that, you reduce the risk of exposing your neighbor who's a nurse, or your dad who's a physician, or your friend who's a medic, or a truck driver, or people we need to go to factories, to run the powerhouses, to keep the aluminum plants going, critical infrastructure. That's the real concern, is the curve is starting to escalate vertically like this as we see more and more cases, as more and more people who've been exposed probably a week ago become symptomatic and critically ill. The other day I saw an interesting picture, an overhead photo that someone had posted of a trainload of Humvees that were out in California. To the average civilian, that can be very disconcerting because in a time like we have now, you become more acutely aware of what's going on. The reason why governors say stay-at-home order is because it's not martial law. It's at that point where you would see military police, you would see a huge presence of people really restricting what you do, and that's not where we're at right now. So when you see something on TV that shows a lot of movement of military equipment, the first thing you should look at, or social media for that matter, is you should say, wait a minute, our military moves all the time. We have an exceptionally broad team of really informed people who understand infectious disease in a way that perhaps a lot of other groups of people working together don't. We spend every day looking at the latest information, looking at states that have already experienced significant peaking, and looking at how we can shape the response of ourselves in the West Virginia Guard, as well as support civilian agencies like the Department of Health and Human Services to be able to react in an anticipatory fashion and not in a purely reactive fashion. We want to be proactive. We want to be ahead of this thing to protect people and keep the numbers as low as possible in this part of the country. The reason why a lot of medical students and residents were sent home is because we do not want to expose you to something, because at the end of this, if it is super serious, we need to have that pipeline of ready physicians ready to go back into healthcare when this is done. That we're trying to protect you, and it's really, really uncomfortable. Curriculums have been disrupted, the normal flow of students have been disrupted, but it's for a purpose. We'll work with you as educators. We'll work with you the best we can. We're going to get you through. You're going to be great physicians, nurses, techs. You will be. But just remember, the reason why a lot of you have been told to go home is because we are trying to protect you. We want to make sure you're not exposed to something that could really hurt you, because those of us who may be exposed that end up having long-term consequences from this or even dying, we need replacements. You're our future. We want to protect that future. We're citizen soldiers. We're all, in some capacity, either working in full-time clinical medicine or dentistry or in nursing care or technician work. One of the greatest things about being a citizen soldier is that networking that we have. So we can call a lot of our civilian colleagues to work with us. And because we have those relationships, they know when they talk to us that they can trust us. So everybody at Ohio University knows I'm a soldier. And that really facilitates response because we can cut down the barriers and talk professional to professional to react to things and properly spread the workload. We have folks that are subject matter experts. So we can shape things like call lines. We can tell people how to take some of the load off of the civilian people manning call lines because we can answer those questions. We have some very specialized units that are really trained to look at serious threats like chemical or biological warfare agents, but they're very easily transitionable to pandemics. And so, for instance, in the case of looking at a nursing home in Morgantown, those teams have all the protective equipment they need to be able to go into that site safely and start screening that site without risking civilian sanitarians and civilian agencies that don't have quite the robust capability we do for basically national security all the time. And then the final thing is that planning piece, that we can sit back and we can really look with educated minds at how do we keep the curve flat? How do we advise our civilian agencies to do that? Those tents you see are really a reflection of history. We know that if we're not successful in what we're advising, we will fill those tents up with people and they'll be very sick. That's dead serious, and that's nothing you haven't heard. So in preparation for two things: one, to account for the need to basically have the dedicated hospitals full of people who are critically ill with COVID, and not put otherwise normal sick people, people with influenza, the people with colds, the people who've been injured, into those facilities where they could be exposed, building that tent capability, building the tents for screening for people who don't have symptoms, keeps what we think are healthy people away from those hospitals, because if they go in, there's a good chance that if they weren't infected, they could come out. So if we build that additional capacity, we have the ability to then treat people more flexibly, the well as well as the infected, until we can get them better. We cannot be clean enough with this problem. But there's also a point that's just you're unable to live your life. So these are tips to help you reduce, not completely eliminate, but reduce risk. And that's understood. And the more we reduce risk, the less the load is on the healthcare system, because the more reduction in risk we do, the less people get sick. At least the less quickly people get sick. And that means that we have more capacity, more ability in the healthcare system to deal with those who do. The approach I use at my own home, which is prudent and pretty aggressive, is I have my wife go down and get the mail. She's wearing a pair of gloves. She puts it in a plastic bag. That stuff can stay out pretty much indefinitely. Outside, we sort through the junk mail, throw it right in the trash with some gloves on. The critical mail, we bring it in, and if we need to, we wipe it down. A lot of these plastic packaging, like FedEx packaging, it's plastic. You can spray it down with Lysol, wait for it to dry, and you'll be safe to open that package. For the perishable stuff, the milk jugs, the cheese, that's all packaged. So, and it's in from the factory, the standards of hygiene in modern American food production are second to none in the world. So inside the contents are fine. It's the outside where someone may have sneezed on it. So a prudent thing to do is spray it down with Lysol spray, Clorox wet wipes, wipe that container down real good, let it sit there until it dries, the solution dries, wash your hands real good, and then put it in your refrigerator. You won't run any risk if it's out there for 10 or 15 minutes on your counter of getting food poisoning or spoiling the food, and you'll contain the problem. For that non-perishable stuff that's either left out in the sun, your pasta, your dried beans, your canned foods, left outside for an hour or so, clean it down real good, and then go ahead and store it once you do your proper hand hygiene, and you should be fine. If you are sick, I want you to call the hotline number if you can't call your family doctor and ask that question. If you can't get a hold of anybody else, and follow normal routine precautions, routine instructions. Going to the hospital directly if you have a question about symptoms is dangerous, because if you do have COVID-19, you haven't warned them that you're coming. If you don't have COVID-19 and you go and are unannounced, you may be exposed to it when you get there. So that phone call is critical. Again, it's a marathon. If it takes you an hour to get through the call line, it's okay. It won't make any difference in your overall care. But it's important you make the call the hotline if you can't get through, and call your unit leadership, because we need to know who's available. Oh, and by the way, the TAG has gone out of its way to allow for telework. There's plenty of jobs we can do, or we can put you to work at home. Believe it or not, we have lots of those options. So get in contact with your first line unit supervisor and make that connection. The N95 mask, that's a really funny looking mask. It's blue and it doesn't look like a surgeon's mask. It looks more aggressive. And the face shields. This is when you're dealing with people who are working with patients in an emergency room setting, where they have to be even more careful because of they don't know who's coming in. They don't have a controlled population. And then we escalate clear up to the PAPR, the powered air purifying respirator. This is for a case when we know there's COVID-19. We know that we're either working in an ICU where it's full of people who are infected. We're working in a nursing home where we know there's infected people. You might even see military-style gas masks, because our current chemical biological warfare gas masks are protective against inhaling that stuff, and so you might see it. That's terrifying to people. A PAPR, you can see everybody's face. In that big gas mask, you look like something out of a horror film. But they're the same thing, basically. They're just designed to protect people going into that environment. You have coronavirus, lots of coronaviruses. Most people have had one that causes common cold. Then you have a specific type of coronavirus called SARS-CoV-2, which is what causes the disease coronavirus disease 2019, or COVID-19. So when you hear COVID-19, what they're really saying is the disease caused by this SARS-CoV-2. Homemade masks. Right now, one of our projects in the West Virginia Guard is looking at the effectiveness of those homemade masks, and we have some data on that. We have some partners we're working with that are working aggressively to help us understand the best guidance we can give to do homemade masks. And I would wear one. If I ran out of one, if I'm not symptomatic but I'm seeing patients, to prevent that droplet spread, which is why we're social distancing, I would wear a homemade mask, because if I cough, it'll catch most of that. And if I'm laundering those daily, I don't expose a patient. Opening windows in any facility, hospital or otherwise, helps dilute all that airflow and make it less likely that you have a high concentration of virus. The solution to pollution is dilution. Sunlight kills COVID, or kills SARS-CoV-2. If you expose that little virus to sunlight for more than an hour, it's gone. Detergent, soap destroys it. So good laundering does it. Washing your hands properly, twinkle, twinkle, little star, happy birthday twice as you sing to yourself, kills COVID-19 virus. I've studied pandemic disease for years. We will get through this. There will be some loss, and we'll have to endure that, and we will endure it properly. There will be some inconvenience. This is like other times in history where people who are strong persevere. Thank you to all of you who are supporting us, who are part of us, our friends, families, and neighbors who are sacrificing right now in ways that many of us can't imagine. We're just doing the best we can for you, and I'm proud to be part of it.